testing is important when it comes to stopping the spread of this virus, but tonight experts are warning if you got to test today because of your Thanksgiving celebrations, well, that was too soon. Here's Jess Arnold now with their warning, all new at 11.
Post-Thanksgiving testing saw some lining up at sites throughout D.C. to get swabbed for COVID Friday.
Better safe than sorry.
The folks we spoke with saying they did socially distance for Thanksgiving, but want to take extra precautions heading into the rest of the holiday season.
Now with the holidays though, even though we celebrate it separately, you want to make sure that, you're extra cautious, extra careful, especially with the virus on the rise.
If you did visit with family for Thanksgiving and want to get tested, infectious disease specialist Dr. Linda Nabha says the best time to do that is when you start feeling symptoms or 5 days after exposure. She stressed, though, that a negative test on that 5th day is not a guarantee. She says you could still be harboring the virus and really should quarantine for 14 days. While the weekend before Thanksgiving saw record high testing per DC data, a site worker at Nats Park told us lines were much shorter Friday.
It was so easy.
Took like 90 seconds, the entire thing.
Rachel Mann noticed another big testing difference this time around. She had to share her insurance information. Last week, Mayor Bowser said they hope that'll help offset some of the cost to the city.
That's why we need things like a federal package to provide funding and relief for state and local governments. They're struggling to maintain this. And so now they're looking to insurance companies to help foot the bill. And with the spike that's coming up, it's going to get worse.
That continuing rise in cases causing this mother and daughter to rethink their plans.
We have been careful, but we have a little bubble of people, and when you start thinking about the contacts everybody has, it just starts to make you nervous. So we're thinking about being a little stricter.
Advice multiple doctors have given: don't let the guard down yet. In Washington, Jess Arnold, WUSA 9.